Excuse me, this is a public service announcement on tobacco.
One of the leading causes of death are tobacco-related illnesses. Tobacco contains nicotine, an addictive chemical that releases a tingling or pleasant sensation when smoked while poisoning you at the same time.
Just one cigarette contains about 7,000 different chemicals. Each day, 1,300 people die from smoking, whether they are a smoker themselves or live with a smoker. Smoking can harm both the user and the people around them, which is called secondhand smoking. Secondhand smoke is especially harmful to young children. It is responsible for between 150,000 to 300,000 lower respiratory tract infections in infants and children under 18 months of age, resulting in between 7,500 to 15,000 hospitalizations each year. In addition, it causes 430 sudden infant death syndrome deaths in the U.S. annually. It is estimated that more than 24 million children have been exposed to secondhand smoke.
However, many children can experience the sensation of smoking firsthand.
About 90% of adult smokers today started smoking when they were a teen or earlier, and 2/3 of teen smokers become daily smokers before they reach 19 years old. If you are to look at it from an everyday perspective, more than 2,500 kids in the U.S. try their first cigarette, and 580 additional kids under 18 become regular daily smokers. That totals to be more than 200,000 new underage smokers in the U.S. alone per year. Smoking can be especially harmful to adolescents because they are still developing and growing, so exposure to nicotine will have lasting changes on brain development. As of now, there are over 1.8 million high school students that are current smokers, and if current rates are to continue, then 5.6 million children under 18 today will eventually die from smoking-related diseases.
It is so important for teens not to give in to trying their first cigarette because the addiction rate for smoking is higher than the addiction rate for marijuana, alcohol, or cocaine, and the addiction can occur within weeks or even days after their first experiment. Yet why is it that major tobacco companies market in places that expose tobacco to the vulnerable youth?
Studies based on the marketing of tobacco companies reveal that these companies do have the motive and success of advertising to children by their industry's efforts. In 2003, there was a global treaty signed agreeing that tobacco companies should not be targeting the youth. The World Health Organization Framework Convention on Tobacco Control was developed to treat the tobacco epidemic around the world and is an evidence-based treaty that reaffirms the right of all people to the highest standard of health. One principle discussed was of companies marketing to children, even though this should be abolished in the treaty, yet the tobacco industry continues to unintentionally attract children. Major tobacco industries spend up to $9.5 billion per year to marketing their products. Their efforts often reach children.
Tobacco companies claim to have stopped targeting and studying children's habits for marketing, yet continue to advertise in places they know can easily reach the youth,
such as placing advertisements around playgrounds, parks, schools, retail stores, and magazines targeting the youth. 90% of all regular smokers begin smoking around or before 18, but if kids stop smoking, then the cigarette industry's marketing sales would decrease rapidly. A report in 2007 by the American Legacy Foundation stated that 78% of people from ages 13 to 18 predominantly smoked the top 3 brands of tobacco that were heavily marketed: Marlboro, Newport, and Camel. Another survey in 2014 by the National Survey on Drug Use and Health reported the same findings. 12 to 17-year-olds would go for these 3 brands of tobacco.
That goes to show that the youth is receptive to advertisement, even though the advertisement is not supposed to be intentionally for them.
This has been a public service announcement on tobacco and its effects on kids.